So I have a patient that is 5'4". She's 68 years old and is roughly 84 pounds. So she's a really small granny. She presented to the ER for us today with right flank pain. Says nothing makes it worse or better. It started yesterday and it's really stabbing and aching feeling. She hasn't tried Tylenol, anything like that. She said it was just 9 out of 10 and it's constant. So she figures she might as well just come into the ER. She also says that she is having urinary frequency, urgency, and she is having some nausea without vomiting. She says other than that, she doesn't have any other symptoms. Her past medical history is GERD, ureteral calculi. She doesn't remember when she had this or where she had this diagnosed at. She also has urinary incontinence and osteoporosis. She does see as outpatient as well. Her last visit was, 6 months ago with Lindsay, one of the NPs. Past surgeries, she had a hysterectomy, total one, in the 60s. She had a kidney stone surgery. She doesn't remember what it was, what type, if it was a lithotripsy, if it was what it was. She doesn't even remember when it was. She has no drug allergies. Doesn't use tobacco, drugs, alcohol. Says she's never done any of that. So Miss Patricia says that she is on Prilosec 20 milligrams daily for her acid reflux. She takes amlodipine for her high blood pressure that her cardiologist prescribed her. And she takes a daily multivitamin and she takes it in the morning. All these she takes in the morning with food. Excuse me. So her ROS was completely negative except for nausea, urinary urgency, and her right flank pain or CVA pain. Her vital signs are blood pressure of 164/90. That is high for her. She said she did not take her amlodipine this morning though. Heart rate is 78. She said that's pretty typical for her. She's on room air, 98%, so great. BMI is 14.41. The nurse did say that she got oxycodone 10 milligrams 20 minutes ago. So we're going to give that a little bit longer, about 10 more minutes to kick in to see if it does help her. This was the first dose. Her physical exam was in normal limits except for her right CVA and suprapubic tenderness. Upon arrival, she did have a UA and she did have a urine culture. The ER doctor ordered them both negative. And then she did have a CTAP, which showed a 1 centimeter calculus in the right distal ureter and mild nephrolithosis. Her creatinine was 0.91 as well on coming in. Her differential diagnoses. So the main one I think she has is a ureteral calculi, and that's because of the CTAP, and she's having symptoms that go with it. The CVA tenderness, right flank pain. Totally makes sense also with her past medical history. It makes sense. It could be a kidney stone. She's had those in the past. However, it's less likely. It's not on the CT scan. And I don't feel like we need an abdominal ultrasound to see if we have any kidney stones. When we go in for the procedure too, Dr. Maurice can definitely look for that, but I think we're just dealing with the ureteral calculi on the right side. It could also be a UCI due to her urinary frequency, incontinence, her symptoms. However, her UA and culture were both negative. We're not going to treat that per urology guidelines. So what I recommend? So I would say a cystoscopy with a right ureter stem placement today. Since Dr. Maurice is on, I'd ask him about adding on the case. After talking to the patient, she hasn't ate since yesterday at noon. She felt like she couldn't. She has been drinking water and staying hydrated, but no sodas, anything like that. So I would let Dr. Maurice know and see when he wants the case added on and if he agrees with my assessment. I would also have her follow up outpatient after the procedure and after she's discharged to get that stent removed, kind of explain that process to her and why we have to remove that stent. It's not permanent. And then I would also say, outpatient, we would discuss definitive stone interventions because this will break up the stone. However, it doesn't necessarily get all the stones and pull them out. Make her NPO. I've already let the nurse know about that. She said she was going to make her NPO anyways. No recommendations for medications right now. ER doctors did good. They have her on IV Rocephin every 12 hours, and they did the oxycodone 10 milligrams every 4 hours as needed. So I don't think we need any of that. And I think now we just need to go talk to Dr. Maurice about the cystoscopy.